Hi, welcome to DIY Breastfeeding. My name is Robin Kaplan. I'm an international board certified lactation consultant, owner of the San Diego Breastfeeding Center, and host of the Boob Group podcast. Today we're talking about some common concerns that some moms might deal with while breastfeeding. Today specifically we're talking about mastitis, the yucky one. So what is mastitis? Mastitis is an infection inside the milk ducts. And so what happens is you get a few symptoms. Some of the symptoms might be red streaking along the breast, very hot and tender to the touch. It's essentially like you have a backup on the freeway. Your milk is trying to come out and it's not coming out, and so it gets really tight in the areas that it's super backed up in. The main concern that most moms start really getting worried about is that they start running a fever of over 102 degrees, as well as they really feel sick, like flu symptoms, like hit by a bus, uncomfortable, really achy. And so they want to find ways to make sure that we can prevent this. So let's talk about that. What causes mastitis? Typically, it can be, again, talking about the milk really backing up. So why would that happen? First, it could be a baby has a really tight latch, and so baby is unable to really effectively remove that milk from the breast. Another thing could be that a mom has an oversupply, and so baby gets on there, feeds fairly well, but a lot of milk is left in the breast, and over time it starts to get more and more backed up and sticky in the milk ducts. It could also be that a mom is relying on an ineffective pump. So if the pump is not removing mom's milk well, it can also get backed up too. Sometimes this may happen when your sweet little baby decides to sleep a lot longer than baby is used to, and so mom wakes up with a really tight, hot breast. Or it could just be that mom is exhausted, which tends to run with what happens when new moms are having, new babies. And so exhaustion often can mean lower immune system, especially in those first 2 weeks, which can make moms more susceptible to getting mastitis. And lastly, milk blisters, those little tiny little pimples at the tip of your nipple. Essentially what that's doing is blocking the exit route, and so what can happen is the milk backs up in that milk duct. So prevention, essentially making sure that when your baby is feeding that your breast feels softer after your baby feeds. Resolving plugged ducts in a timely manner so that they don't get too backed up, but the milk is actually helping to relieve itself within about 24 hours. If your baby's an ineffective breastfeeder, either due to a lip tie or tongue tie, prematurity, or any other feeding challenges, getting the help from an IBCLC as soon as you can to protect your milk supply, as well as making sure that your baby becomes a more effective feeder and comfortable, as well as removing that milk. So if you end up getting mastitis, there are lots of different treatments that you can use. First off, if it's caught quickly and essentially within the first 24 hours, it often can be treated without antibiotics. And so how would you treat this? Well, lots of rest. Remember, your immune system is being kind of taxed as much as it possibly can take. And so getting lots of rest, lots of fluids, lots of warm, yummy soups, things that you would have if you actually had the flu. Breastfeeding or pumping every 2 to 3 hours to help remove that milk. One of my favorite local acupuncturists recommend actually using a tincture of dandelion root. So apparently dandelion is a natural antibiotic. And so you can take this, a dropper full, this is called a tincture. So you usually find them in a dark colored container, and you take a dropper full of it in water because it's really bitter, but every 6 hours, and it can help to relieve your fever as well as the infection. Another thing would be taking castor oil on a compress. So castor oil is used to break up blockages below the skin. So we do not want to ingest it because it will cause wicked diarrhea, but you can put it on a wool cloth or even a face cloth, pop this in the microwave for about 10-15 seconds just so it's warm enough to the touch but doesn't burn, and then you place it over the area that is really plugged up and uncomfortable. And what happens is you leave it on there for about 20 minutes, take it off, pour some more on there, heat it up again, put it back on, and do this off and on throughout the day. It actually can help break up the blockages below the skin. Now remember, it does cause wicked diarrhea. So before you feed that baby or before you use a pump, you want to get warm soapy water on a compress, face cloth, wipe that off really well. We do not want baby to ingest any of this castor oil. That's not a good thing. Another thing that can be really helpful is doing just really high quantities of echinacea and vitamin C to help boost your immune system. You'd want to talk to your doctor or midwife or lactation consultant to ask for the best dosage for this. You can just take the dosage that's recommended on the container, but a little bit higher than that can also really help boost your immune system. And if all else fails, if none of this holistic stuff is working for you, you can call your OBGYN or midwife to ask for antibiotics to help get rid of the infection. Just remember though that anytime you or your baby gets antibiotics, you are at an increased risk for thrush, so you would want to start probiotics as well to help kind of keep away that yeast infection. So hopefully this gives you enough information to really know if you have mastitis, how to get rid of it, how to prevent it, and hopefully you will never get it. Thanks again for watching DIY breastfeeding. If you would like more videos, please subscribe to our YouTube channel, as well as you can always check on our websites, both the San Diego Breastfeeding Center as well as New Mommy Media, for articles and podcasts about all things having to do with breastfeeding. Thanks so much.